Welcome and you can welcome and give it to Surendra sir.
Okay. Good evening, everybody. I'm welcoming all to our evening's program. I'm requesting Surendra sir to take the class forward. Surendra sir, please go ahead and Surendra sir. You're muted, sir. You can unmute. You can unmute yourself. Unmute yourself.
Speaker.
Unmute. Speaker on பண்ணுங்க. Surendra sir, speaker on பண்ணுங்க.
Yes.
Mic on பண்ணுங்க. Sorry.
Yes, is audible? See, Tridosha in homeopathy.
Yeah, yes. Okay.
See, it's only comparison. For effective understanding of the philosophy and theory. I already told you what is Tridosha. In Sanskrit it is called three faults. Literally it is called three faults. That is, three elements of the human body most likely to be deranged and produce disease. What is homeopathy? We say normal healthy being, when his health is deranged due to some internal malady
Sir, சொல்லுங்க.
which cannot be overcome by his vital force, then medicine is
Sir,
required
கூப்பிட்டீங்களா?
to support.
Hello?
What the medicine does, it goes and helps
மிஸ்டு கால் வந்து.
the vital, that is, it attacks the disease force, thereby the vital force is given a free hand. That is, in a traffic, police constables pay way for the vehicles. Like that, medicine is only to induce and to remove the obstacle for the vital force to act. A very simple thing, when gone deep into, becomes complicated. How, sir? How, sir? What is it that you are giving? All right? Deficiency in the body. What is the deficiency is called? How do you term it? Name it? Then how do you compensate it? There are hundreds of medicine. Can you simply blindly close your eye, pick up and give it? So that, though externally and outwardly it seems to be very simple, when application means it's a difficult matter. In the sense, for the physician it is not at all a difficult one. For a layman it's a difficult one. He feels after something is deranged. What are the ill effects? Vata, Pitta, Kapha. Or we call it air, fire and water. They are the inner motors of the outer garment of the human body. It's beautifully coined word. Elements of air, fire and water, which are the inner elements of the body, or inner elements of the motors. Motors means organs. Kidneys, heart, stomach, nervous system, brain, etc., liver, etc., and its supporting organs. Outer garment is human body. Expressing, you appear as a human. To identify you, you are given a name. When you are called by name, you turn up. Like that, all human beings are given name. All human beings have got internal organs, when these are governed by air, fire and water in a proportionate condition. What is that proportionate condition? I will learn it by going into each chapter. These are called Vata, Pitta, Kapha in Sanskrit. Okay. See, whether Ayurveda, Siddha, Unani, or even we call it modern medicine, they are done by principle. It's not as if anything has emerged without any fundamental purpose. Okay. Now we will go to the cosmic elements of Vata, Pitta, Kapha. That is fire, air and water. Elements of air, that is topmost of all the three concepts. The element of air is the vital force present in the everywhere in the body, in the every cell. That is why I said, when metabolic activity takes place, how when the brain gives a signal to the different organs, that is, the digestion to take place, they give orders to the stomach. If they have to see or read, they give instructions to the eyes. If you want to run, they give instructions to the limbs.
పెట్టడం పోగండి
Every cell is called oxygen or air. There is some proportion, some energy is there. But when you use excessive work or you give excessive work to the organ or body and energy supplied. Energy goes there, which contains also the air, then metabolic activities take place. Metabolic activities produce energy and you do your work. Yes. the air resides in the intestine, thighs, loins, feet, bones, urinary bladder, pelvis. In all these organs, there will be present more. Air maintains the two other elements, namely the fire and water, with some principles. Otherwise, there will be a fight. If there is no principle means, it will be a fight. And with these principles, they control their functions. There are 5 kinds of air which have 5 different functions in the human body. Prana, vital. This is mainly the cavities of the mouth, head, thorax, including the heart and lung, the ears, tongue and nose. It enables the food to go into the stomach due to its location near the heart. It protects the life from destruction. Then the Udana, the upward, it occupies upward part of the body, especially throat and seats of umbilicus and thorax. Thorax region, throat region, umbilical region. Samana is in an even place, that is located in the umbilical region between the stomach and intestine, helps digestion more. Jnana, diffuse, it presents throughout the human organism. It supplies rasa, that is serum, that is energy, or the fluid to the all parts of the body, keeps them lubricated and causes the outflow of blood and perspiration. Because of the activity to kidneys, to skin and to excretory organs, thus it functions. Autonomy, downward, especially seat for value is the rectum, and the main functions of this is very to carry down the waste material, feces and urine, etc. Apana vayu is located in the 2 testicles, penis, hip joints, bladder, the thighs and the umbilicus. It is easily understandable because it is written. Supposing I don't know about things, where this element of air is accumulated, what it does, I will not be able to answer. Now, it has been studied by the from Vedic period to Sultan, even before that. So therefore, whatever the position it is there, they restrict their activities with reference to the position. Then, aggregates of air. By wrestling with man of superior strength, by violent exercise, excessive physical and mental work, excessive worries, continued anxiety, the element of air is aggravated. Then, modern application of electricity, violent rays of X-rays and radium surely aggravates the element of air. Temperament of air. A person of air temperament can be recognized in various ways. The excess of air is wakeful, averse to cold, and is fond of music. There are cracks in the features on the palms and so. His back hair, mustache, fingers, nails, hairs are rough, brittle and greasy. He is a man of hot temperament, habit of biting fingers, nails, grinding his teeth, etc. Sir, you said grinding of teeth is a symptom for burns in the stomach. Might be. He indulges in incoherent thoughts and fails to save money. That is, he's a spendthrift. Then comes the principal seat of air is a large intestine. It is meant for pacification of this element, that is larger intestine, by using any enema. If the air is in its principal place, is passed by enema and other places of pacify in the same manner as the stop when removed makes the room cool and gradual change. That is, a state of air, if it is excessive there, it causes inconvenience. It's called enema, bloated. Then comes comparison. Supposing room is temperature is made more high by lighting the stove, it becomes more heat. Then it will cut out the stove. The heat gradually reduces. The room temperature comes to normal. This is the theory applied to the stomach by the sun as excessive air or low condition of air. Homeopathic medicine, having alternation between hours of 2 and 6 or by night, like that. Medicinal activation, like Pansatilla in the afternoon, they are all called the air medicine. Tuja and the epic pellicata are aggravated between the hours of 3 to 6 in the afternoon, and they are called the air medicine. Like that, there are many comparisons. I go to one after. Let's go to the fire and water, then we compare the comparison. Then comes the concept of comparison. Ayurveda, science of life. Remaining disciple of Indian system of medicine through Persia. See how it is described, disciple of an Indian system of medicine through Persia. Both are causing disturbances, hava, that is air or water. Then comes the modern nuclear physics. Neutron, electron, proton. Neutron, electron is called pitta and proton is called water. So, we are able to compare any system of education, any system of understanding the human functions within nature with certain principles. There is no doubt about these principles. What I think is a person who can, that is, for example, given a computer or to operate in a canal, whereas when you are practicing, I master it, I can easily understand. Same thing applies to even medicine, application of medicine, and different applications of medicine by different theories like allopathy, Ayurveda, Siddha, United. So you have got a very greater and broader understanding. One need not be afraid of. When we concentrate into one system and deeply going, you can tackle it very easily. You need not think about, oh, should I use Unani, should have been very better. No. That will give you more failures than success. When you choose homeopathy, cling to homeopathy, but try to understand other systems of comparison. Try to bring in the theory of application. What is application? Taking precautions in the food, taking precautions in the habitats, taking precautions in the taking the exercise, etc. So these external applications with your internal correction will make you more happy. So yesterday I seen one man being brought out from cave in Vastagar Sea. They termed his age as 188 years. He travelled from northern India to some caves in southern India, and he was brought out with 2 or 3 people slowly bringing them. His pulse rate is normal. His pulse rate is normal. In other words, his body functions are normal. That's why I am bringing to the comparison. I don't know what he has taken, and whether he has been taking only air at the foot. That's possible. Nothing is impossible in this universe. Only thing is we don't know. One can live with one take of food, either in the morning, afternoon or evening. Jains take in the evening. Muslims go for fasting for 30 days. Hindus go for fasting on Saturday for Ekadasi. Nothing is going to happen to them. It's character God. That is what the external application of change. Yes. Next week I will tell you about the concept of fire and water. Okay, thank you.
The skin diseases. We are talking about psoriasis. Psoriasis is the skin
The
to what extent psoriasis can affect us, or what is psoriasis and how it can be managed, whether it can be cured or not, and all those are things we can discuss here. And we will also talk about homeopathic approach to psoriasis. So psoriasis is a chronic, that is a long-lasting skin disease which is caused by immune system overaction. They're causing the cells to multiply too quickly. So immune system reacts to the some stimulus and it starts reacting, overacting, and it makes the skin cells to multiply faster than required, and then it becomes a thick patch there. It is an autoimmune condition that leads to rapid growth of skin cells, resulting in scaly patches, thick scaly patches. The patches of the skin become scaly because the skin peels off from there and inflates. Most often the scalp is seen on the scalp, that is on the head, skin above the head, scalp, then elbows and knees. But other parts of the body can also be affected easily. The cause of psoriasis is not fully understood. It is clear that it is due to some genetic factor, immune system dysfunction. Environmental factors also act towards showing this up, and anyone can get psoriasis. It is most common in adults than in children. That is the difference. Adults get more, and it affects men and women equally. So you can see how bad, how difficult it will be for a patient like this. Everywhere in the body you can see patches which will start scaling off. The skin will start peeling off, and it will be everywhere, front and back, and everywhere. This is the condition of psoriasis. This is called plaque psoriasis. We discussed different types of psoriasis in the coming minutes. So now, a normal skin cross section, you can see it will be like this. The top layer is thin, that is the outermost layer is the there, and it is thin like that. And the epidermis, you can see, is a normal size. And then we have dermis and subdermis layer. Where you can see the thin layer is inflamed. It is so thick. And on top of that you can see flakes, and then the skin is peeling off. Otherwise all the skin, everything is same, but above that goes the flake formation. So this is what we see, skin is peeling off, and thick white patches and all are seen because of this is the cross section of the psoriatic patients.
Chappari water in a person.
So now you can compare psoriasis with eczema also. Psoriasis, you can see this having white patches in the inflamed area, whereas eczema has no such white patches are not there, but inflammation is seen all over. The picture is not very clear, but you can see this white patches are here on the psoriasis patient, whereas on the eczema patient, the skin is normal but looks like it is reddish and inflamed. That's all. So psoriasis symptoms of psoriasis are like red patches covered with thick silvery scales, itching and pain will be there. This is the symptom. This can sometimes go through cycles of flare up for a few weeks or months, followed by periods where they subside and go into remission. So this is the pattern. It go up and come down, and then remain down, and then come back again. The treatment can be planned based on the type and severity of the disease. So the treatment will be depending on the type of expression. Mild psoriasis can often be successfully treated with creams and ointments, while moderate and severe psoriasis may require pills, injections, or light treatment. Managing common triggers such as stress and skin injuries can also help in keeping the symptoms under control. So our stress levels also can cause skin injury, skin damages like psoriasis. and even injuries to skin also can trigger
Psoriasis.
psoriasis. So you can imagine
Symptoms are
this
not
is the reason for psoriasis.
medicines.
Having psoriasis carries the risk of getting other serious conditions including psoriatic arthritis, a common form of arthritis that causes pain, swelling, stiffness of the joints and places where the tendons and ligaments attach to the bones. So there you have stiffness and swelling. So where the tendons and joints, the bones join together, that is the joint erection, where the bone has tendons and the muscles join there, tendons of the muscles joining on the bone, there will be swelling. That's called psoriatic arthritis or symptoms. The next is cardiovascular events, such as heart attacks and strokes can also be the end results of the psoriasis. Mental health problems such as feeling low esteem, anxiety and depression because of the skin condition, he will be very much depressed to see himself with such a bad skin condition, and he will go low esteem, he will have anxiety and depression. People with psoriasis may also be more likely to get certain cancers, Crohn's disease, diabetes, metabolic syndrome, obesity, osteoporosis, uveitis, that is middle eye inflammation. So uveitis, then liver disease and kidney disease. There are different types of psoriasis, which include plaque psoriasis. This is the most common kind of psoriasis, and this appears as raised red patches of skin that is covered by silvery white scales. So there will be raised red skin patches, and on the top of that we have seen now, you will have white patches here. The patches usually develop in the cylindrical pattern on the body and tend to appear on the scalp, trunk, limbs, especially on the elbows and knees. Then the other is luteate psoriasis. This is a type of psoriasis that appear in children or young adults and looks like small red dots, typically on the torso, on the body, torso or the limbs. The outbreak are often triggered by an upper respiratory tract infection such as sore throat, strep throat is called, sore throat, which is an infection of the throat and tonsils caused by Streptococcus bacteria. So strep throat is called, sore throat we call it, and that can be the trigger for the sort of guttate psoriasis. You will see the pictures of it. So this is the plaque psoriasis. You can see it's on the hand and this on the elbow region. So this will be like you can see white plaques. Here also you have red underlining and white plaques and silvery colored flakes are there. This one plaque psoriasis. Next is the luteate psoriasis. You can see all over the body, neck and face everywhere you have these sort of small patches with the skin peeling off and red patches. So now we will talk of another three types of psoriasis. There is pustular psoriasis. This is in this type, pus-filled bumps called pustules surround the red skin appear. So here not only the red patches, you have pus-filled small bumps. It usually affects the hands or feet, but there are forms that covers almost of the body also. Some have this pus-filled psoriasis all over the body. Symptoms can be triggered by medications, infections, stress, and certain chemicals which the patient is exposed to. Then is inverse psoriasis. Inverse psoriasis. This is the form that appears as smooth red patches. There is no raised levels. It will be smooth red patches of folds of skin, such as it is beneath the breast or in the groins or in the armpits. Rubbing and sweating can make it worse. So inverse psoriasis will be smooth red patches of in the folds of skin under where the skins are rubbing together beneath the breast or in the groin region or armpits. Rubbing and swelling can make the thing worse. So the next is erythrodermic psoriasis. This is a rare but severe form of psoriasis characterized by red, scaly skin over most of the body. It can be triggered by bad sunburn. If you go to the sun and sunburns can be triggered by this. It can or certain medications such as corticosteroids And this condition often develops in people who have different types of psoriasis and do not and is not well controlled, and it can be very serious also. So pustular psoriasis, you can see this is the psoriasis of the
ఎంత ఘోరంగా ఉంది సార్
and you can
కాలు
see
మీద
the
సోరియాసిస్
axis here.
ఈ బొమ్మలను చూపిస్తాను
Is formed, and when it is pus is gone, it will heal up like that. But again, somewhere it will pop up again. This is example of pustular psoriasis. This is the inverse psoriasis. You can see under the breast you have this red patch. It is smooth. It is not lifted. It is smooth. And center also everywhere is like where the skin runs. It has these sort of smooth red color patches. It can be under the breast also and under the groins also. This is called inverse psoriasis. This is the erythrodermic psoriasis. Very sad and pathetic to see a patient like this. Everywhere in the skin is all psoriatic mixed. It is as a uniform one, and it is looks like a reaction to some medicines or some sort of sun exposure or something. Whole body is with the psoriatic lesions and inflammations. Next is symptoms of psoriasis vary from person to person, but some common ones are patches of thick red skin with silvery white scales that itch or burn, typically on the elbows, knees, scalp, trunk, palms, and soles of the feet. This is the common feature. Dry, cracked skin that itches or bleeds is another common factor. Thick, ridged, pitted nails. Nails also will get affected by psoriatic issues, and I will show you pictures of that. Poor sleep quality also will be the symptom, common symptom. You can see nail also. You can see all bad. Normal nail is like this, whereas one of the nails have been affected badly, and you can see this all thick and uneven and distorted. So that is the psoriasis affecting the nail. Now, some patients have related conditions called psoriatic arthritis, which can be characterized by stiff, swollen, or painful joints, neck or back pain, and actually heel pain. If one has symptoms of psoriatic arthritis, it is important to see a doctor soon, because untreated psoriatic arthritis can lead to irreversible damage. So many organs can go into trouble and then to be not treatable. Anyway, psoriasis is not curable fully, so it can be managed, but if it's not attended on time, it can cause a lot of degenerative issues which can never be reversed. The symptoms of psoriasis can come and go. Patients may find that there are times when the symptoms are go worse as called flares, followed by times they feel better as a remission time. So it can be up and down. That is common method of psoriatic lesions. So psoriatic arthritis is a normal arthritis like healing, but the patches will be seen on the skin of the fingers and all these things, but again pain will be there in the joints. Psoriatic arthritis. So the psoriasis is an immune-mediated disease. So the process is, it's an immune-mediated disease, which means our body's immune system starts overacting and causes the problem. If one has psoriasis, his immune cells become active and produce molecules that set off rapid production of cells. So immune system will trigger rapid production of cells. This is why the skin in the people with the disease is inflamed and scaly. It is not fully understood what triggers the faulty immune cell activation, but we know that it involves a combination of genetic and environmental factors. Many people with psoriasis have family history of the disease, and researchers have pinpointed some genes that may contribute to develop the psoriatic lesions. Many of them play a role in functioning of the immune system. Some external factors that may increase the chances of developing psoriasis include infections, especially streptococcal and HIV infections will trigger these sort of psoriatic lesions. Certain medicines such as drugs for treating heart disease, malaria, mental health problems also can be the triggers. Smoking can be a trigger, and obesity is also be a trigger for causing psoriasis. So we will just rush through the allopathic treatment methods. and then go to the homeopathic side. These medications can help to manage symptoms and involve and improve qualities of life, but they don't cure the conditions. Some treatments include topical treatments, that is ointments type of thing, topical treatments, corticosteroid, salicylic acid and vitamin D are often prescribed for mild and moderate psoriasis. Corticosteroids are available as creams, lotions, ointments and solutions. So the topical applied skin applications is one of the treatments. Next is oral medication, that is methotrexate. It's a weekly oral dose that reduces the skin production and inflammation. That is one of the medicines, the pills what we have that are doing weekly. Next is acetylprin. It is a retinoid pill that reduces skin cell production. Then cyclosporin is an oral eye medication. It suppresses the immune system for severe psoriasis, but it can't be used continuously for more than a year. So that is the restriction is also there. It can be used, but it cannot be used for prolonged treatment. Injection medicines like triamcinolone is a steroid that can be injected directly into the persistent psoriatic patches. Then biologics are injected drugs that alter the immune system to improve the symptoms. So injection medicines also are there. Treatments aim to reduce the symptoms and help the disease enter remission period of the period of little to no disease activities. So when injections are given or treatments are given, if the disease will go into remission and will remain there inactive for some time. So that is all what the treatment can do. We will see homeopathy. Homeopathic remedies for psoriasis are selected based on the unique characteristics of the patient's condition, including the appearance of the skin lesions, their locations on the body, and any emotional or environmental factors that may influence the person's health. So we select medicines on the person's conditions. In constitution-based treatment, totality of mental and physical symptoms of the individual is only considered. Irrespective of the names of the disease or organs, we all know that we go for totality of symptoms, and we reach to success by constitutional treatment. By addressing the root cause and the triggers of the skin inflammation by constitutional corrections, homeopathy aims to reduce the frequency and severity of outbreaks, improve skin health, and enhance the patient's overall well-being. So this is how we approach into, or this you see the medicines which will help in treatment. So here are some homeopathic medicines commonly recommended for psoriatic patients. That is arsenic album. It's the best indicated for individuals experiencing dry, scaly, itching skin that feels better with warmth. It is often prescribed for skin inflammation that worsens during night and in cold weather. So arsenic album is one of the best remedies. Next is graphitis, recommended for those with thick, rough, dry skin lesions. That is recommended for those with thick, rough, dry skin lesions covered with sticky discharge. Graphitis have always sticky discharges. So graphitis is particularly effective for skin inflammation that appears on the scalp, behind the ears, or knees, or elbows, or in genital areas. The graphitis and skin, you can see there will be gummy discharges, gum-like discharges, so thick discharges are there, sticky discharges. Next is sulfur, indicated for fiery red inflamed lesions that are itchy and burning. It is often used when symptoms worsen with heat and water, indicating deep-seated systemic issues. Sulfur is given when there is fiery red inflammation and it is burning and itching, and it is indicated that there is a problem with deep-seated. Vistocks will work on chronic skin conditions that improves with motion but worsens in cold, damp weather or during rest. This remedy is used for individuals with joint pains associated with psoriatic arthritis. So psoriatic arthritis, any arthritis will stop work, and the important point is it improves with motion and worsens with rest. So rest stop. Next is petroleum, prescribed for deep cracks and fissures in the skin, especially of the hands and feet. It is especially beneficial for skin conditions that worsens in winter and improves in summer. So petroleum is a normal skin medicine what we prescribe for people who have dry skins, and they normally have these sort of problems in worsens in winter and improves in summer. So petroleum works very well for such people, and petroleum is good for this condition with psoriasis also. Next is sepia, effective for chronic skin conditions that appears in the skin folds, such as underarms, behind the knees, or in the groin. So this will be good for inverse psoriasis also. And it is recommended for individuals who feel better with exercise and worse in cold, damp climates. So calcareous calf, best indicated for individuals with chilly, clammy skin, that is sweaty skin, clammy skin, and a tendency of sweating easily, especially in the scalp. Calcareous calf is suited for people who are easily fatigued and crave for sweets. So this also works for treating psoriasis. Staph aureus is known that it works as anti-inflammatory remedy. It is known that it is working as anti-inflammatory remedy, and it works for psoriasis also. It works for the inflammation, controlling the inflammation of psoriatic patients. It is most used for scalp psoriasis. Basidium is a plant-based shrub, medicine, a flowering shrub used in homeopathic for thick, crusty plates. It is poisonous to humans when ingested or put into the skin in unpotentialized form. In homeopathic potency, it treats psoriasis and its inflammation. Borax is erysipelas of in the face. This red patches of the face and itching on the back of the finger joint. Unhealthy skin, chilblains relieved in open air, faint eruptions on the fingers and hands, itching and stinging. So it will be based on the like the redness of the face, itching on the back of the fingers, unhealthy skin, chilblains, like infections, like on the joints of the fingers and those joint fingers, the toes, and it is relieved by open air. Then it will be itchy and stinging pain also today. Then arsenic iodide, psoriasis with dry, scaly, itching, marked exfoliation. The skin will keep on peeling off, or the skin is large scale. Large scales with sheets will be removed, leaving raw, exuding surface beneath. So skin peels off, and below that you will see exuding, the oozing skin will be left behind. Ichthyosis, that is like fish scales, like the scales will be found there, and eczema of the beard. On the face we have eczema, watery, oozing, itching. Not thick oozing, it's watery oozing, itching and worse on washing. So this is arsenic iodide symptom. It works on these sort of expressions of psoriasis. The thyroid psoriasis is associated with adiposity. So the adiposity is a fat skin, the tissue-based psoriasis. Dry skin, impoverished and cold hands and feet. Eczema, ichthyosis, lupus, and itching or with eruption worse at night. The thyroidism is a also that it works on deep acting issues because the problems addressed are in the fat tissues. Other commonly indicated remedies are Mersol, Antimtap, Rhizobium, then Calias, Calibrom, Lycopodium, Magnum Asticum, and many others are there, so I will list a few. So this is all what we have to discuss now on the psoriasis. You know the worst and the grave condition of psoriasis. We have discussed almost all. So next we will be taking some other skin disease shortly. That's all for the time. Thank you all.
Sir, Suresh Kumar sir.
Where is sir?
Suresh Kumar sir.
Suresh Kumar sir,
Mandar.
Yes, sir.
Yes, you can take sir.
Continue?
Yes, you can take sir. You can take.
Okay.
Your voice is audible.
Thank you. A warm greeting to all group members. And few weeks back, we were continuing some important therapeutic index. So in that series will continue, and the objective of this therapeutic index giving is, when we sit in the clinic, immediately the main remedies should come and flash in our mind, and immediately we should recapitulate the prime remedies. That is the objective of furnishing this therapeutic indexes. So we'll continue. So the last class I start with calculi. In calculi we saw binary calculi, the remedies of Burgess, selenium and China. So three remedies, prime remedies, and when we think of renal remedy, renal calculi, their important remedies, obviously the berberis, sarsaparilla and Pereira brevia. So these are things which we discussed, and we'll continue with that. In when we call carcinoma or cancer, in that situation, what are the important prime remedies that is indicated for the cancer? So first in this series is arsenic album, very important remedy. Then aurum metallicum, hydracitis, phytolacca, Caecale cornatum, and of course nosode is carcinosin nosode is there. So these are some of the prime remedies we can always think for the cancer. Of course we have to think where the location, what are the type of cancers, everything we have to take into account. But once we say cancer, and in that scenario, what are the prime remedies that are the arsenic album, aurum metallicum, hydracis, phytolacca, Caecale cornatum, and your carcinosin is the top prime remedies we can list it down. Then coming to carbuncle in this series. What is carbuncle? It is a cluster of coils with many openings and connected with each other under the skin, caused by the primary causation or etiology is Staphylococcus urens bacteria. This is the causative organism, Staphylococcus urens, and normally the carbuncle indicated remedies are again arsenic album, lachesis, then Tarantula cubensis, Silesia, Echinacea, and Anthracene. These are the some of the prime remedies which is indicated for the carbuncle. So I repeat: arsenic album, lachesis, Tarantula cubensis, Silesia, Echinacea, and Anthracene. So these are some of the prime remedies for carbuncle. Then coming to another condition with the eye cataract. So what are the prime remedies for cataract? We all know that the eye drop Cineraria maritima is very commonly applicable and used remedy for cataract, but that is for external application. Then what can be the internal remedies with reference to cataract? So prime remedies are again phosphorus, calcarea fluor, then sulfur as a constitutional remedy, lycopodium as a constitutional remedy, chromium and arnica. These are some of the remedies also indicated for your cataract condition. Of course, in some of the conditions we use causticum also. So when we say cataract, immediately these remedies should come in the mind of the physician. So repeating this indicated remedies is phosphorus, calcarea fluor, sulfur and lyco as constitutional remedies, chromium and arnica.
of course, Cinerea Marittima for its application. I also added causticum in this list. So, these are the some of the primary reasons to cataract condition. Then coming to cataract and cold. Whenever there is an acute cold is there, what are the important remedies we can think of? Or we can say, otherwise another term is coryza also. So coryza induces discharge, acute discharge from the nasal tract. So what are the prime remedies for that? The first immediately the mind goes is your alium cepa. Then the other remedy is your euphrasia. Then your natrum muralicum, and then gelsemium, then aconite. So these are the immediately we think of the primaries. So alium cepa, euphrasia, aconite, natrum, gelsemium, these are the primaries immediately flashes on brain. But apart from this, for the cataract conditions, we have one other remedies like calipite, natrum sulph, orontif, pulsatilla, and then eucalyptus, and these are the additional remedies we can always fall back for this condition. So not only the alium cepa or the euphrasia or the gelsemium and natrum, but apart from this we have aconite, we have calipite, we have orontif, and natrum sulph, and eucalyptus ignoranti, and pulsatilla also. So definitely we can think of this complete range of remedies for the cataract or cold, or otherwise we can term as coryza also. Then coming to the other condition, cellulitis. Cellulitis is a painful skin infection. Skin appears discolored, swollen, hot and tender. Usually affects the arms and legs both, or either arms or other legs also. So cellulitis is a painful skin infection. For cellulitis, two top remedies are there. These are your Rustox and Apis. Very prime remedy and very effective also. In my clinical condition, both the remedies are used for cellulitis, and I have had a very good success with these two remedies for cellulitis. And because I found that my mother-in-law was suffering from cellulitis, I had to apply Rustox and Apis together. Then it gave a lot of relief in case this condition, cellulitis condition. So definitely Rustox and Apis are very good remedies for cellulitis. Then coming to another remedies, chancre. Chancre is a heart tumor due to syphilitic condition, and it later assumes the form of ulcer and appears as lesion also, and it turns to lesion and ulcer in 3 weeks of time, 21 days. So it begins as a tumor and then later assumes the form of ulcer in a 3 weeks time because of the syphilitic background. So for the chancre, what are the important remedies? Important remedies are your listing is your Merck iron flavum, very important remedy, Merck iron flavum. Then nitric acid, kali iode, of course another prime remedy, arsenic album, I forgot to tell, arsenic album, and then Merxol also. In Merck family we can think of always Merxol as well as Merck iron flavum together both, and for this condition kali iode and nitric acid also can work well for the chancre. So I repeat, for chancre we can think of arsenic album, nitric acid, iode, and mud salt and mud iode. So these are the prime remedies for this given disease condition. Then coming to another condition, cholera. It is also known as cholera asiatica. For cholera, where it appears as epidemic form, in such situation, we can think of remedies like arsenic album, camphor, and then definitely very good remedy is veratrum album. Top class remedy is veratrum album, then cuprum metallicum, then podophyllum, and croton. So this is some of the important remedies for the cholera epidemic condition: arsenic album, camphor, veratrum album, cuprum metallicum, podophyllum, and croton tick. So these are the important remedies for that. But in this another classification of disease cholera infantum is that. Apart from this is a purely pediatric condition called infantum. It is a non-contagious disturbance and occurring infants in intestine and condition similar to cholera. So it is an intestinal condition of the infants similar to cholera. In this we can add Agendum nigricum for this, and Aethusa, Calcarea fors, and Megaurium also, Agendum nigricum also. So these are some of the prime remedies for the cholera infantum. I repeat: Aethusa, Calcarea fors, Agendum nigricum, Megaurium, and some of the masters are also indicated Sorinum also for as a constitutional remedy for cholera infantum. So these are some of the top grade remedies for cholera infantum. Then coming to next in the alphabet is chorea. Chorea is a ceaseless occurrence of rapid, jerky, involuntary movement. So it's a rapid, jerky, and involuntary movement, and is a ceaseless occurrence, happens in chorea. So what are the important remedies for chorea? Is the agaricus, tarantula, ginkgum metallicum, cuprum metallicum, then causticum, and mygale. These are some of the prime remedies for chorea-like condition. I repeat: agaricus, tarantula, ginkgum metallicum, cuprum metallicum, mygale, and causticum. These are the prime remedies for given condition. Then coming to next in disease stage is your climatic disorders. There may be many situations or conditions with reference to climatic conditions, but in general, what are the prime remedies for the climatic disorders? Among them is first, if we say sepia, the topmost remedy is your sepia, no doubt about it. But apart from this, inside your lachesis, cimicifuga, then Belispa, then amyl nitrosome. So these are the other indicated prime remedies for climatic disorders. So repeating: sepia, lachesis, cimicifuga, Belispa, and amyl nitrosome are some of the important prime remedies for the climatic disorders. Then coming to next series is colic. Very important. Very frequently we come across this condition, colic, abdominal pain. What are the important remedies for this? Definitely Macphos and Colosin are the top grade remedies, no doubt about it. But along with Macphos and Colosin, we can think of other prime remedies like chamomilla, nux vomica, Plantum metallicum, and Diascorea. These are the other remedies we can think of for prescribing in colic condition. So I repeat, Macfast, Colocin, Nexvomica, Chamomilla, Plumber metallicum and diastolic. So these are some of the important remedies for colic situations. Then next condition is constipation. Constipation is also very frequently occurring clinical conditions. So, and particularly with more with the geriatric patients. So we can, what are the important prime remedies for constipation? Now, the first, when we think of constipation, is your Nexvomica, no doubt about it. Then alumina, it says very important remedy. Apart from this, alumina and Nexvomica, the other prime remedies are graphitis, the plumber metal, platina, and natrum muriaticum, and then opium. Opium is very rarely we use for in our clinical condition, but it is also one of the finest remedies for the constipation. So for constipation, we can think Nexvomica, alumina, and graphitis, natrum muriaticum, platina, and opium. These are the indicators. Then another condition is convulsions. Convulsions, it is an involuntary contraction of and series of contraction of the voluntary muscles. It is a series of contraction of the voluntary muscles. So in this situation, definitely always we think of bell first in our mind. Then other remedies for convulsions. The important remedies is your Cuprum metallicum, then Silesia, then Chamomilla, then we can think of Hyoscyamus, and we can also think of Cicuta virosa also. So in convulsions, we can other wide range remedies. Apart from belladonna, we have got Chamomilla, we have got Cuprum metallicum, we have got Hyoscyamus, we have got what's called Cicuta virosa also. So these are the other prime remedies we can think of in convulsions conditions. Then cons, very common conditions in clinical situations. What are cons we can prescribe? Every person nowadays having this problem, cons, development of cons in the soles. So prime remedies, definitely antimonium pura, no doubt about it. But not only this antimonium pura, we can always think of other remedies like ferrum, then nitric acid, then arsenic album, and apart from this, your gelsemium also. Gelsemium also comes in the column, and other indicated remedies, Sabadira also. So these are the other rarely used remedies I have added to this list, apart from antimonium and nitric acid. So I repeat, for the colon we can use antimonium, nitric acid, ferrum picricum, arsenic album, gelsemium, and Sabadira also. The last, today we will conclude with another typical condition, conjunctivitis. For conjunctivitis, it is a opacity of the opacity of the lens, and it's a protein decomposition in the lens. That's why opacity is there, and vision impairment occurs. So in this patient, what are the important remedies we can think of? Definitely, euthanasia is a first remedy we always think of for conjunctivitis. Apart from this, we have arnica, we have argentum ventricum, we have aconite, we have pulsatilla, and another very rare remedy used, it is known as Gauria. I spell it Gauria, G-U-A-R-E-A, Gauria. Gauria is another very rarely used remedy for conjunctivitis, but very effective remedy also. So for conjunctivitis, we can think of euthanasia, arnica, argentum nitricum, aconite, pulsatilla, and goria. So these are the other indicated remedies, list of indicated remedies for conjunctivitis and inflammation of the conjunctiva. So with this, we'll give a pause here and we'll continue with more disease condition, clinical disease condition in coming days. Over to Dr. Murthy.
Is my voice audible?
Yes, sir.
Namaste, my dear homeopaths. Today our three faculty members have taken excellent lectures, given the deep description of several medicines. Please, I will send audio also. Please listen that one and note down. Lastly, our Surendra sir has told about Vayu, air. For that only, from our ancients onwards, every week or every paksha, that is every 15 days, we have to, should not take anything except water. So we must be on Vayu and Jala. Solid foods we should not take. Nowadays our people are totally limited, very limited water is taking, and Vayu also they are not taking fully. Totally chest has to be filled with our oxygen. So we have to breathe inside deeply and get the entire thing outside, carbon dioxide. These things they are not doing. Even our meditation, if we tell that breathing exercise, nobody is doing that one. So Vayu is more important along with Jala, that he has taken excellent day, and Anup Kumar sir has taken psoriasis. It is one of the best disease where no therapy can treat properly. All therapies having its own limitations there. So psoriasis patient, forever he is telling psoriasis, only 30%, 40%, 50% will be reduced. So we are having excellent medicines. If we constantly give good advices to him, and here the psoriasis area, apart from medication, we have to give diet and regimen also. Diet is the most important for psoriasis patients. They should not take non-veg. Mutton they should not take. Fish also they should not take. They must take always vegetarian food and sattvic food apart from this one. And another thing, if anything negative thoughts dwelling in their mind means that should be eradicated, then psoriasis will be reduced. Pleasant mind, pleasant food, pleasant body will make psoriasis patient very quick relief. So in that manner, and our Suresh Kumar sir has told, he has taken one by one several medicines, very good medicines he has taken. That also please remember, those are the very good medicines. Lastly, our Suresh sir has told conjunctivitis. Whatever the medicines he has told, apart from that, any medicine are you getting to your mind? Apart from that medicines, because he has told Euphrasia and argentum nitricum, don't tell. Regularly we are using certain medicines, one or two medicines. Those are very important for conjunctivitis. What are they? Frequently we are using in our houses two medicines. One is for Vodema. Next one is thick bland discharge. What are the medicines? I have told the symptom also. If any burning, abnormal burning sensation is there, Epismel will work along with belladonna. 1 or 2 doses sufficient during the course itself. And one is bland discharge and very thick discharge is there, then pulsatilla is one of the best remedy. These two remedies we should not forget. After proper treatment also, if you give 2 days or 3 days pulsatilla, it will reduce and again it will not come back. Any doubts from your side? Because our 3 faculties are taken very deeply and very systematically 3 lectures today. Any doubts in this or any doubts previously also? If there is no doubt means we will close. your masters. And today is our strength is only 14. Out of 14, only our MPHA members are 7 old students.
Sir, I have a question. Dr. Suresh has mentioned about cataract
Yes.
medicines. Suppose a person has done the cataract eye surgery of one eye and there is an ocular lens implanted, and subsequently the other eye is getting cataract. If we take any medicines in homeo, whatever you have suggested, is there any effect on the ocular lens?
No, nothing. The second eye which is not operated, there you have to take, you can take Cineraria maritana, that drops you can take. The second eye which is not operated. And what are the medicines Suresh sir has told? All the medicines will work for conjunctivitis, even if the patient is having, I have more than 10 years, my cataracts, both eyes I have controlled. Even now also, if anything comes means I will take all the medicines. Nothing will happen.
Okay, thank you, sir.
Only cataract operated person should not go to any inflammable area. That is the most important. In gas stove, we should not, some people, when boiling water or boiling milk will be there, at that time they will go in deep nearer to that one and oof they will tell. That we should not do now. Because the heat should not touch the eye. That is the only thing. And any dust is there or any abnormal smoke is there, we have to avoid. At that time we have to use the glasses.
Okay, sir.
Okay.
Suresh Kumar, can you give notes on these medicines?
Yeah, definitely. After completing the entire thing,
Yes, sir.
I'll compile and circulate to all of you.
Yes.
Because this is being taking, because for the clinical point of view, this is very important.
Yes.
When we sit in the clinics, we should recapitulate immediately some of the important prime methods. So that is one of the prime necessity for taking this.
Well, we cannot work everything so quickly.
Definitely, I will, after finishing, the entire set of this notes will be circulated to all of you.
Thank you, sir. Thank you.
Sir, with nasal coryza also you have mentioned. One of the prime medicine is Agium Seppa. What about, you have not mentioned about Sabadilla, I think. Sabadilla is also being used, no sir?
Yes, Sabadilla you can use when sneezing is there. When sneezing is there, you can use. Alias Sepa and Sabadilla will work excellently. Running nose with sneezing. Sabadilla is one of the best remedy for sneezing.
So we have to go step by step. We have to go step by step. First we have to address with a minimum medicine, that is start us with ADM-CEPA. Sneezing comes, then we can go for other medicines and all. Symptom also changes, no?
Generally, Alias Sepa should not be clubbed with any medicine. It action will, Alias Sepa action will be overtaken by other medicine. For that, when Alias Sepa we are giving excellent, except belladonna, we should not touch other medicines.
Doctor,
Sir.
definitely this Sabadilla comes in for coryza neck condition, no doubt about it. But what is important is that there are many remedies indicated for common cold. There are many remedies, but I am just giving you two important, the first line of defense. That is more important.
Yes.
Definitely, when we remember the first line of defense remedies, then we can always go for second line of defense remedy, taking some time from the patient. That's the prime objective. First we make a first prescription immediately, then we will have some time to pause and retake the case and come to next other remedies. The objective is to give first line of defense, then also provide you with second line of defense also.
Okay, sir. Thank you.
If no question is there, we will close the session, sir.
Sir, Suresh sir, for sensibilities you told Prostact and Apicnea.
Yes.
How many days it will take for cure, sir?
It takes at least for I've treated cellulitis, it takes nearly 1 nearly 3 weeks to 4 weeks it takes.
Okay.
It takes almost in a serious. It again depends upon the extent of the disease. Again, and chronicity of the disease also. But for prolonged use of this Restox and Epismel, very good results happens. Though it takes little time more, but definitely you can think of also Arnica also supplement in cellulitis. You can think of Arnica also to have a circulatory correction as well as a Belladonna also. Always Belladonna is very handy, and we can think of Belladonna, Arnica supporting along with Apis and Restox. So I'm not added to that list, but correcting the circulatory disorder with Bell also is very important. You can add Bell also in cellulitis.
Okay. Okay. Thank you, sir.
But can Puja be used for bone? I mean, does it help for psoriasis?
Puja.
Puja is what?
No. It is not correct, sir. Puja we should not give. It will work, but it will spoil other medicines action.
Okay.
So we will close the session.
Okay, sir. Thank you all.
Thank you, sir. Thank you.
Yeah.
Thank you, sir. Thank you, sir.
Thank you.